Good evening, neighbors. June Margolin, Huntington Matters Community Forum. Sorry, Dana. We have Dana behind the camera. We have Diane Shaber, our producer, tonight. And then this is our final installment on our candidate interviews for election 2023. And once again, your local elections are the most important elections that you could participate in. So you look out your door, you look left, right, everything you see is under the purview of your local officials. So it's super important for you to get to know all about your choices at the polls so that you can make the best selection for your family. And today we have the privilege and honor of speaking to REBECCA SANIN, who's running for Suffolk County Legislator for the 16th District, which is great. And we're going to talk about the lines have kind of gotten a little squiggly and changing for January. I think the 16th district was the most impacted, right?
Mm-hmm. It was significantly impacted.
Yeah,
yes.
16 and 17 were like really reshuffled around. Anyway, so we're going to get to know a little bit about her, and yeah, that's it. So thank you for coming.
It's my joy to be here. Thank you for having me.
Yeah, you must be tired. You look
I'm
tired,
running out of adrenaline.
That's great. All right, so if you could give everybody an introduction, a little bit about yourself,
Sure.
background.
So REBECCA SANIN, so happy to be running to be our next legislator in the 16th district. I have a long background and history in public service. My entire career has been either in government, the nonprofit sector, or education, where I've had the opportunity to serve Long Islanders throughout my career. And my current role is as CEO of the Health and Welfare Council of Long Island, which is an umbrella agency for the nonprofit sector across the region. So we do a lot of regional planning, a lot of disaster preparedness, a lot of work on health equity and other really critical priorities for the region, as well as helping our small business nonprofits to be successful and sustainable. And prior to that, I was an assistant deputy county executive in the Bologna administration, where I helped to lead the performance management team, which is all about making government more efficient, more productive, delivering better services, and being more responsive to the needs of constituents. And I think what I would just say to you makes me, distinguishes me as a candidate is that I love people. And, you know, I think there are a lot of folks who have qualifications when it comes to running for office in terms of experience, in terms of credentials. But I think being an empath and being a person who really loves people and looks at life as an opportunity to lift people up and looks at government as an opportunity to be that rising tide that raises all boats, that's what we need in a time where there's so much global instability and so many challenges facing our state and our region. So it's a joy to be here.
Excellent, thank you. So with Health and Welfare Council, can you give us like an example of some of the stuff that you guys take care of?
Yeah, absolutely. So again, we're an umbrella organization for the nonprofit sector. So we work with about 250 nonprofits on sustainability, on capacity building, making sure they're able to have everything they need to be as successful as they can be in delivering resources to our communities. We run coalitions, so we bring people together, multi-stakeholder coalitions, to address the complex issues that we face as Long Islanders and to do regional planning, something that often doesn't happen with our fractured layers of government in this region. And we do advocacy work, so we advocate with our federal, state, and local officials for nonprofits, the needs of nonprofits, as well as the communities they serve. So what we're seeing are needs, developing and emerging, making sure that our officials know what that looks like and how they can be responsive to us. And then we also provide direct services, helping people with combating hunger through enrollment in SNAP, helping folks to combat disease and health inequity by connecting folks to the marketplace, making sure that people have insurance. We are the regional administrator for the Emergency Food and Shelter Program, so making sure that we're doing everything we can to address the needs of our most vulnerable residents and really, really making sure that the nonprofits that serve the entirety of our region have what they need to be successful.
Okay, got it. All right, now I understand. Because in some situations you guys jump in directly. But then in other situations, I was a little confused about
A lot of times we're representing our sector and making
Right.
sure that we're doing everything we can so that the human services that are provided on Long Island are innovative and second to none to meet the needs.
Very good. All right, thank you. All right, so we do a little civics lesson at the top of all these interviews, just in case helps us all learn a little bit more about how government works. So what is the job description of a Suffolk County legislator, and what is the legislature as a whole exclusively responsible for?
Yeah, sure. So when I think about what my responsibilities will be as a legislator, I think of a couple things. First of all, obviously, there's a tremendous fiscal piece to this, which is overseeing and improving budgets, capital budgets, the college's budget, the operating budget, and that's both about fiscal responsibility as well as to some degree being a watchdog and making sure that the budgets are prepared appropriately to meet the needs and not provide duplication of services. So certainly fiscal oversight is a huge piece of it. Sponsoring resolutions, passing laws that impact and improve people's quality of life is absolutely a vital piece of it. And it's an area where I think I have particular strength because since I worked for 5.5 years in the executive office in operations with all the different departments for the most part across the county, I understand that so often laws are passed that are not able to be implemented effectively, and that we really need to work with departments hand in hand with our amazing county employees to make sure that the laws that we pass are workable and make sense, right? And then there's constituent navigation, which is a key piece of the work as well, making sure that we're helping our constituents to get the services they need to live the best lives that they can live in the legislative district as well as across Suffolk County. And then this might be something that you haven't heard before, but I feel very strongly that a legislator also has to be an advocate with every level of government. And so while there are things that are outside of the purview of county government, if they're affecting my constituents, then I have a responsibility to stand with them and stand up for them. And so that at the federal level, that might be when we look at SALT, the state and local tax deduction, a huge issue impacting homeowners here in the district. When we look at the state, making sure we're able to maintain local control and make decisions that we need to make. And when we look at the town, making sure we're working hand in hand on so many of the priorities that actually get enacted at the local level.
Yeah, very good. Yep, that's great. All right, serving as, so this, again, we've already kind of answered this, but we'll just talk about it anyway. The Suffolk County Legislator position is the time commitment for the job. Let's talk about that. Is it correct that it's 30 hours? It's about 30 hours a week. That's the minimum time commitment, right?
It's a part-time position that I think requires a lot of full-time love and support. If I am so privileged to be elected as the next legislator, I would be stepping down from my position as CEO at the Health and Welfare Council. I am not a person who has ever worked a typical, people who know me know this, a typical 40-hour work week. So there may be other things that I do and other work that I do, but I feel very strongly that my priority will be making sure that my constituents have everything they need from my office and that I'm using the office to improve people's lives.
Very good. Okay, great. So what skills or qualities do you have that will make you a great legislator?
Great question. So certainly, experience, right? I led the nonprofit sector through the COVID-19 crisis, convening twice weekly meetings with every layer of government, working with FEMA, working with about 200 executives on a weekly basis to make sure we're streamlining and coordinating information. I helped lead the Superstorm Sandy recovery effort when I was in the county. And I think this is a time when the people we elect into office need to be crisis managers as well. And so I think that's a unique tool a unique quality that I bring to the table. Certainly the leadership experience, certainly the executive experience, certainly an enormous amount of community experience. I became the person I am, the advocate that I am today in many ways when the Jack Abrams School was closing in my community, and I had been a PTA president, and I was very opposed to the closure of the school, and it really woke up that advocacy in me and the need to be a voice. And so that for sure. And then, I really do believe empathy is a credential when you run for office. If you can't put yourself in other people's sacred shoes that are different than you, if you can't have cultural humility, if you can't understand the different needs and the different challenges people face, I don't know how you represent them.
Right.
And I'm very much an empath, and I love people deeply. And I look at being in the legislature in some ways as an opportunity to use policy as a way of loving our neighbors and lifting up their lives.
Great. All right. Can you give an example? I'm sure you have multiple. An example or two of situations that require creative, out-of-the-box solutions that you're proud of.
That's a great question.
That's mine.
I like that question.
I ask everybody that. To me, it shows We need to see the creative problem solving.
Yeah, no, absolutely.
Attributes of the candidates.
So one example, so many of you know, I think, know that I led the Census 2020 efforts across our region to make sure that we had an accurate count, to make sure we got the billions of dollars that we needed in New York State for the next 10 years for infrastructure and schools and everything that we care about. And so we started that effort in 2018. Really doing the planning work. In fact, right now I'm doing work for the 2030 census in my organization to make sure we're doing the planning work and to make sure we're advancing the toolkits and the skills that people need to be successful. So we had 11 subcommittees of multi-stakeholder groups that met every couple weeks, and we worked so hard on building these toolkits and building strategy, and we were so excited and ready to go, and it was going to start, and then boom, COVID hit. And we were like, what, we can't do in-person outreach? What?
Yeah.
And so we had to really quickly and, be nimble and quickly shift on a dime and, reinvent our strategy and look at how we use digital tools and look at how we meet people where they are in a way that continues to allow us to be successful and get a high completion rate.
And how high was our rate? Was pretty good.
We did very well, and we were actually, Long Island was a model for the rest of the state. I was asked to go through NISAC and through other associations to help train other parts of the state through the process because we built such a robust infrastructure, really what I call, a census army of ambassadors of message, right? An army of love, not of weapons. But that was a real example. And the other piece of that was during COVID, we saw lots of human crises explode, right? Things that we know about, things like addiction and mental health crises, obviously, but things that other people might not think about, domestic violence and child abuse and other kinds of issues because there was such stress on families. And so we also needed to innovate in that space. And so we said, well, how are we going to get to people if they can't come into organizations? And so we worked on building out strategic information that we could put in our food pantries with all the food bags that people were getting, that we could put in different ways, and we created an entire toolkit around hospitals. And how do we get...
A lot of people were getting food support.
People were getting food support. People were getting medical support. So how do we work with those folks to get information that they don't typically provide into the hands of community? And that was very successful. So that's an example. And I would say the second example was during the federal shutdown, which lasted 35 days. The last federal shutdown, something I'm very afraid could be a potential, given the chaos that we're seeing, that we've seen in the House. And so all of a sudden there's a shutdown and there's folks who have never needed to rely on services in their entire lives, who had absolutely no expectation that this was going to happen and didn't have sort of the baseline knowledge about what services were available to them. Right. That often in communities that are under-resourced, there's mayors, there's informal people who can share information with you when you're in a crisis, and that didn't exist here. So really pulling together multiple layers of government and nonprofit organizations and community members to say, what do we need to educate people about so that they can make sure that they have the resources they need and can live their best lives. I would say those are two examples.
Oh, that's great. Yeah, and I remember during the shutdown, we had someone from the Coast Guard Center, right, reach out to us. Because the Coast Guard wasn't getting paid, and there was that Coast Guard. Where's that in Lloyd Harbor?
Yeah,
Eaton's Neck.
Yep.
Right? And they were talking about, there were 16 families or something.
We worked with them. I worked with Steve Israel to pull together a lot of different, resources and folks that we don't necessarily typically interact with. But it was fascinating. Some of the things that people would ask us, if I allow myself to have this benefit, will that count against my child when they go to college? How long will I have to repay this assistance? And just really a lot of questions like that. And so we actually right now are putting together material that we're sending out through the organization that I run to nonprofits about sort of myths and facts, so that if there is a shutdown, we're prepared from what we learned prior and we're able to make sure people have the information they need to make good decisions for their families.
Very good, very good. All right, we're going to shift here to housing, affordable housing, which is a huge issue in our community. So when we say affordable, we are actually right now discussing the HUD formula for affordable housing, and that's actually what it's called. The formula is called affordable housing. So it's an 80% of the area median income and then it's based on your family size too. So when a project is granted the affordable housing status, it's like a whole big thing that goes to the state and comes back and all that, and then they run the lottery. We invariably get members saying, well, that rent's not affordable, right? So affordable is subjective, family to family, right? So based on your circumstances and your other expenses and like that. So for the purposes of this conversation, the affordable housing HUD formula we're going to really refer to as workforce housing. So it's not low income housing, right? So here's the question. Our town desperately needs more affordable workforce housing. Despite Huntington's very robust affordable housing requirement with a zone change, with the cost of land materials, labor, and taxes, developers frequently claim it's just not possible to build an entire affordable housing project. What more can the county do to help motivate or incentivize affordable development?
It's a great question. And let me just...
That's, whose question was that?
I'll just say everybody had great questions.
Yeah.
Let me start with saying that one of the things that I think about when I look at the challenge we face with affordable housing is that it's actually a public health crisis.
Yeah.
And so, I think that there's a bunch of things that we need to do. As a person who today leads a nonprofit organization, I can tell you when it comes to direct services over the last 6.5 years that I've been there, affordable housing has been the number one call that we've received over and over again about people who just can't find affordable housing. Today, I would...
So is it affordable or low income? Or both?
Or both. No, it's both. It's really both.
Yeah.
And then I would say today that the other call that we get the most is around the mental health crisis. But so it's a public health crisis, and we learned that during COVID-19 in particular. I think it unmasked some of that when people were coming out of hospitals and being asked to quarantine and they share a bathroom with 17 people, because when you don't have affordable housing, multiple families are stuffing into single dwelling units, which create all sorts of health and safety issues for them, but also for the community. And so we have to look at it as a public health crisis. What that means is that we need to engage our medical systems, our healthcare systems in this conversation. And there are examples across the nation of, MCOs, managed care organizations, and medical systems looking at building housing as a way of offsetting medical costs. Because when a person doesn't have solid housing, they can't store their medication, they can't cook, they can't sleep well, it's a huge social driver of poor health. And so figuring out ways to be creative and innovative in that strategy, I think, is important. Second thing is obviously working with the town and figuring out where the opportunities exist to create affordable housing that the community wants for itself, and being a partner in that space. And then as a county, looking at funding the infrastructure that needs to go into that. So wastewater infrastructure being a huge piece of that.
Yes, you're saying that's really right now the grants that they have for developers is really about infrastructure. That's pretty much it.
But there's other things we can do besides just the infrastructure. I mean, I think we also need to, one of the mistakes we make on Long Island a lot as leaders is we live in our bubble of Long Island, and we don't look at, there's some really interesting things happening all across the country when it comes to affordability, and we need to look at that, and we need to look at national examples and learn from them and bring people here to teach us about successful strategies that they've had, and I would be very excited to do that.
Yeah, I agree. Looking in other places that have done it right is always the easiest place to start, I think, So for the last decade, we've had at least one of our Huntington legislators on the county's Public Safety Committee, which has screened each new police commissioner, which we're going to have to do again because Commissioner Harrison resigned, and brought new technology and resources to our SCPD 2nd Precinct, including more officers and equipment. What public safety priorities do you have, and how would you work with other layers of government to achieve them? Sure.
And let me answer that in a bunch of different ways. First of all, I want to say that I think it's one of the mistakes that elected officials often make is they think they have to know everything. And I will never do that, right? I'm very transparent, and I know where my expertise is, and I didn't go to John Jay College, and I'm not a police officer, right? So the first thing is bringing our law enforcement experts to the table and listening and building those friendships and continuing those friendships because, I have very strong relationships with our law enforcement. And really listening to what their priorities are. Because it's not about how I feel, it's about data, what we need. It's about, working with folks who know what we need. So that's point number one. I've done a lot of work I've worked with Drew Fiorello, who many of us here in Huntington know really well, in Homeland Security in Suffolk County. We just finished training like, I don't have the number, but many nonprofits across Suffolk County in active shooter protocols. It was a type of capacity building that I wanted to bring to the sector. How do you keep your office and your clients safe, right? I think that what I hear the most at the doors when it comes to public safety is around the roads these days. You know, dangerous driving, speeding, use of ATVs in dangerous ways. And it's something that every corner of my district, and this is a vast district, including parts of the town of Islip, every corner of the district talks about this. From the highest SES, the lowest SES, to the, you know, you name the demographics, how you look at it, how you splice it. Everybody's worried about the roads, and we have to do something about that, and that has to be a priority when you look at the fatalities and you look at the injuries we have in this county. And then another thing that I really want to look at, and again in concert with law enforcement, is crime prevention through environmental design, which is a strategy around how do you look at the assets and the challenges in a community and strengthen the assets and reduce the challenges. So if you have a road, for example, where you know there's a lot of drug sales and it's hard to catch folks because there's capacity for them to hide. You know, you study, does it make sense to make that road a one-way road so that there's one way in, you know, so that people can't go in both directions, right? So there's all different kinds of things that you can do around environmental design that impact safety. And then, lighting is a huge thing, right? There's so many different pieces to that. And then lastly, you know, I've spent a lot of time over the years working with Sheriff Toulon. In fact, I just keynoted his task force on recidivism a couple weeks ago. And I've spent a lot of time in our jails, looking at our jails and visiting and spending time with our folks over there. And what I've learned is that most people behind bars incarcerated today in Suffolk County are there because they have an untreated mental health condition or an addiction issue that they didn't get treatment for. There's a percentage of people that are, you know, not good people that need to, you know, we want to see them back there. But folks who lacked access to treatment and are sick, we need to, you know, develop strategies around diversion and making sure we're getting people the tools that they need to be well, and then not to offend, and certainly once they've been in jail, not to re-offend. And that's also a priority of mine. It's a human service issue that has a huge public safety implication. And I believe deeply that we can do better here in Suffolk County for our residents.
Yeah, there were, in the past, prior to the bail and discovery reform, there was an opportunity that we spoke to some defense attorneys that they would be able to like immediately negotiate like rehab for their clients right there, because the arraignments were the next day, always. So they could, you know, you had someone come in, they were at their bottom, and then they could kind of like be ready to go into treatment or whatever, they would agree to it, and then that could be part of like an agreement with the court, a diversion, exactly. But now with here's your paper, and you're going to be arraigned in weeks, you know what I mean? Like, unfortunately, it's kind of a lost opportunity, but they're trying to figure out ways to get that support still put in there.
And there's so many other things too. There's other pieces of intervention, right? There's a whole piece of prevention and working with our schools that's vital. But there's also, you know, I've talked to folks, for example, our EMTs, right, who tell me, you know, the repeat calls they have to the same houses, right, where folks go to Huntington Hospital and they detox and then they, you know, end up back there in a couple of weeks. And we need to not continually bring people to a place for them to leave, for them to go back, for them to leave. We need to figure out new strategies and new ways to intervene. And I believe there's so many creative and quite frankly exciting ways that we can help to lift people's lives up who are dealing with the crisis of both addiction and the mental health crisis that we face.
And they have to be willing. Because it's the other bit, is they can say, thanks, oh, that's great, Rebecca, that sounds like a great program.
But that's also why we have to do the prevention work, because when you look at the trajectory of illness, and when you look at the trajectory of costs of treating illness, the more that we catch when something is brand new, when someone is just starting to struggle, the less likely that they're going to suffer for the rest of their lives, the less likely that the cost of their treatment is going to be exponential. And so we have to do the prevention work, and it has to be data driven. That's really important as well.
Yeah, Barry from Huntington Drug and Alcohol was saying that even middle school is too old. You need to start talking to them before middle
Absolutely, and giving them the skills and the tools to be able to resist.
Yeah, so like really working with the school districts and giving them, Yep. Okay, great. So let's see the next one. Here we go. Dovetailing. The county will be has received significant funding from the lawsuit suing opioid drug manufacturers for lying about their medications' addictive properties. The funds are earmarked to be spent on treatment, prevention, and support services for the addicted. If you could choose, how would you like to see those funds spent? Of course, we do know that it's the nonprofits that have to apply for the funds, and it's project-based, and really the legislature doesn't have the ability to say, we think it should be spent this way, but just to get an idea.
Yeah, no, absolutely. Look, I think addiction is a thief in the night. It steals people's potentials, it destroys families, and it's one of the most painful things that we deal with in our society. When we look at those dollars, right, and I think the legislature has a huge responsibility, and I think they're working very hard in doing this now, reviewing the applications that come in and figuring out what is innovative, when you look at an application that is coming in from a nonprofit organization and you're in government, you have to look at sustainability, right? It's not just about, okay, if you have $100,000 today, what are you able to do for the 6 months? But how are you going to use these dollars to leverage other funds so that that program can be sustainable and so that we can continue to meet people's needs and really leverage these dollars and get other matching opportunities.
Right.
So we have amazing nonprofits on Long Island. I am very, very proud of our nonprofit sector, and we have amazing nonprofits in the addiction and mental health space that are doing innovative work every day right now. And so this is an example of where I think government needs to also lean on the experts, right? And to make sure that they're invited to the table to provide applications and to provide their information and data about what's most needed, what they're seeing in the street and in community, and then work with them in partnership.
Yeah, my fear, and it's not, just because government is government, and it could be just where you end up with the exact same organizations requesting each round of funding. It's just the same organizations because maybe they don't, the other ones, smaller ones, may not know about it. So I was
government has a right, and it's a good point. I think it's a great point, right? I think that it's really, really important as leaders to make sure that we are advertising opportunity and that we are bringing new people to the table. But it's also important, to your point about folks who continually get funded. If an organization has developed an area of expertise, we want to continue to strengthen that area of expertise. Because at the end of the day, our responsibility is about the people on the other end of that service and making sure that they have what they need to live their best lives and to get into recovery.
Correct. All right, so here's
let me just say one other thing really quickly. The other challenge we have on Long Island is there's a lot of predatory companies that come up from Florida and from other places and try to get people into treatment because of the high cost of that, and it's not it's not high quality, and it's not data driven, and it's not evidence based, and so it is our absolute responsibility as government to make sure that when we are looking at funding treatment modalities, that they are evidence-based and that we're making sure that every single taxpayer dollar is used to improve people's lives to the very best that it can.
Gotcha. Okay, great. All right, next question. Physical and mental health. What improvements do you propose? That's a big one for you. That's a big one. I have a laundry list of things.
No, absolutely. Look,
mental health for sure. That's like a huge situation, especially we were talking about for children. It's just so difficult to find providers that will take
So
insurance.
I will talk to you about some of the stuff I'm doing today in that space. So certainly on the mental health side, I started getting calls from our school districts, from our National Suffolk School Board Association, from superintendents across Long Island, more so probably about a year ago, about how there was just this emerging mental health crisis in facing our children post-COVID. And it's not just a mental health crisis facing children, it's also facing faculty and staff and families. And then, it's this sort of, perfect storm of, economic instability from COVID, isolation, stress, all of these different things. And now you have a workforce shortage. So people are, under so much stress and are not, our schools in some cases are really struggling to hire folks for certain positions. At the same time, the children's needs are greater than they've ever been, right? So there's a bunch of things we need to do. Number one, we need to build a pipeline, because you hit the nail right on the head. There's a complete dearth of providers. I get these calls from parents who have sometimes high-level expertise in this space and high-level connections, and they can't get appointments. So can you imagine if you're somebody trying to navigate the complex services here on Long Island, where we have 2 counties, 125 school districts, 13 towns, 95 incorporated villages, and on and on and on.
And
it's
you're using
hard.
Child Health Plus.
And you're right.
Nobody takes it.
It's so hard.
Yeah.
And so we need to build a pipeline, which means starting with our schools and working with our schools on assessments and making sure we're catching kids earlier. We're looking at ACEs. We're looking at we're looking at trauma-informed responses and care for kids, and addressing that earlier, and also making it exciting to go into fields that provide mental health services. So we often bring policemen and firemen and different folks into our schools. We also need to bring psychologists and social workers and make sure that kids see that as a path for themselves. That's number one. Number two, we need to work with our colleges and universities on Long Island, and I just recently started this process as well, to really look at what are the courses? What are the certifications? What are the doctorate programs? Where are they? How are they being offered? Are we doing enough to, really train up a strong workforce? And then third is working with OMH and working with our partners in government across the board to say, okay, so if we get this pipeline, how are we retaining them here so they don't go to North Carolina where the cost of living is less expensive, right?
Right, or the salary,
or the salary.
Salaries are, it's just not,
it's very difficult.
Beyond not a living wage.
Right.
For these people, for these professionals, and it's a emotionally taxing, demanding.
It is.
It's like you could be a 911 operator. It's like that kind of a crisis situation when you're dealing with.
It's 100%.
Then the insurance wants to pay them $3.
100%.
What can the legislator do about that one fact? It's the insurance issue. The rest of all these things that you guys, the legislature won't do anything about. That's not their scope. Like Sharon, she's
Richmond,
up in
Yeah, I love Sharon. Yeah.
That's where our assemblymen and all those guys
Yep.
come in. We're not going to change the cost of
Well-
insurance in the Suffolk County Legislature.
Right, correct.
But if you get the whole.
But what we need to do is build a pipeline of services. And so you can provide services. So we have federally qualified health centers. We have the Dolan Center. We have Sun River Health, where folks who are underinsured or uninsured can still access care. But the issue is we don't have providers, and we have such a dearth here on Long Island. So that we need to deal with. I will tell you on the insurance side,
Which
there's
then goes into affordable housing.
there's a lot of other, there's a lot.
What can the legislature
Yeah, the
do
workforce
about that? What would
housing.
you do?
So it's advocating. So on the insurance side, if that's what you're asking me, it's advocating with our state that oversees managed care organizations, right? Looking at parity, working with the Attorney General's office on, when Timothy's Law is being violated and parity is not being protected and preserved, working on, the fact that there's often so many denials that families face when they're trying to access care. It's probably one of the most tragic aspects of what it's like for a family when they're going through something and they have a place that they can get care and the insurance covers it, but the insurance is denying care because they think a person hasn't gotten through an earlier level of care. So really advocating with our state government, but also being collecting those stories, right? And so that we can, because I always say to people, I'm a data person. I love evidence. I want to make
data is what drives change.
And I want to make decisions based on data always.
Yeah.
But when you look at what pulls on people's heartstrings, sometimes policymakers, it's the stories. So we also need to work with community and organize those stories and make sure that we're doing that advocacy in an effective way. That's at the state level, but there's a lot we can do as a county to strengthen our organizations that are providing these mental health services, to improve access and opportunity to addiction and mental health services, to improve the cultural humility and proficiency of these services so that, that there's equity. And then looking at equity, looking at, when you look at our communities, where are there opportunities to access care? Are they near bus stops for folks who don't have public transportation? How is that happening? And I also think, though, you brought up affordable housing again. When we look at the crises we face, we also need our resources around us. And our resources in many cases are our families. And I can't tell you how many doors I've knocked on in the last month where folks have literally started crying at the door about how their families are disappearing and leaving and going to all sorts of states. And there's this family dissolution because of the fact that there's affordability issues.
Correct.
And then that ends up adding additional stress to families. And we end up, sometimes in...
And they have less support.
And they have less support.
Less people
So we have a responsibility, I think, to look very holistically at people's lives and figure out where are those opportunities that we can impact as a legislature, but where there aren't those opportunities, being an advocate with other layers of government and making sure that we're very clear about what's happening for our constituents. And that people, I think anybody watching this who actually knows me knows I'm a relentless advocate. When we have to get something done, we're going to get it done. And so really fighting for people is important.
Very good. All right. Environment. here we go. What will you propose or do to help get our beaches usable after it rains? It is said that toxic rainwater runoff is responsible for most of our beach closures. How do you plan to address this?
So the environment is a huge part of why I'm running, quite frankly, this year, because I am terrified about what I see happening with climate change in our societies and what we need to do as a region. We live above our sole aquifer, and we are not doing what we need to do in terms of our sustainability and our safety and our public health. So when it comes to runoff, most of the roads here in this district are town roads. Mm-hmm. They aren't county roads, so it's really would be absolutely vital to me to partner with Andre Sorrentino, the town superintendent of highways, to look at ways that we can get county and state dollars to help address this issue mm-hmm. with the town in partnership with the highway department. And I really believe there's opportunities with the Environmental Bond Act in the state, and I would want to partner with him in order to advocate to get those dollars and to do the work that he needs to do and we need to do to protect our beaches and our waterways.
Tom was talking about some of the storm drains.
Mm-hmm.
They haven't been, they've been there since the 60s,
yep.
some of them, and they haven't been touched or...
Right.
Yeah.
And it's the squeaky wheel, right? And that's when I talk about advocacy. It's we need to, identify these issues, and then again, there's, we passed the Environmental Bond Act. We need to get those dollars and draw them down into our community for the issues we face.
Mm-hmm. So we have been also talking about the hello, I'm tired, I'm sorry. Water bill?
Yeah.
Yeah, we've been talking to each candidate, but it's not on the list, but we've been talking to everybody about it.
Sure.
About the water bill.
And so I know this is a touchy subject for some folks, but I'm going to tell you, exactly, where I stand on this. A recent Moody's report showed that Long Island is the fourth most vulnerable region in the entire United States of America to the economic and physical impacts of climate change. Number 3 was New York City, with whom we share a mutual economy. We saw what happened a few weeks ago when that deluge came down and our subways were ultimately, shut down, right? There are huge environmental issues we have to take on as a county, and there is nothing at the moment that is a more urgent priority than addressing, our public health and our public safety. Suffolk County government, needs to focus on public health, public safety, and social services. A lot of the other things we do don't need to be the priority. The priority has to be public health and public safety. So I look at the fact that this didn't end up on the referendum as quite frankly a crisis. I really do. I think number one, to deny voters the opportunity to choose clean water for their families is not something we should accept. Number 2, I think it was a violation of public trust, because when you are an elected official, it is a privilege to serve. And I will always trust the voters to make decisions for their safety and for their families. We need sewers desperately in Suffolk County, but this was 10 years in the making, right? And so we can't have sewers everywhere. I would love to have sewers everywhere, but I'm never going to make decisions based on what I personally want. I'm going to make them based on data and evidence and studies and what's important and what people need and want in communities. We need to upgrade our IA systems, our septic systems. You saw the article today about algae blooms being the highest this summer than they've ever been on Long Island, right? Because of nitrogen. We have nitrogen leaking into the sole aquifer that we live above every single day. Suffolk County is the number 1 county in the 62 counties in New York State for use of herbicides and pesticides. We're the Green Lawn County, but we have to start thinking differently about what that looks like if we want to if we want to enjoy public health, if we want to enjoy a beautiful future and all the wonderful things that are important on Long Island. So, clean water would be a priority to me, and if I am on the legislature, making sure that this referendum happens quickly. Is certainly a priority to me, because every day that we are not moving forward on this, we're losing federal and state matching dollars. It's costing us financially, but most importantly, it's costing us in terms of our public health, and that has to be, a sacred priority to any elected official.
Yeah. So this has become, a really big topic for this,
as it should. Legislature.
Yes, the legislature candidates for this election period. So we got to talk to everybody, people that are sitting in there and were part of the conversations of it happening, and then, people that are opposed to it and all that stuff. So through talking to everybody, a little piece here and there, we learned that Tom told us that it was Fred Thiel.
Mm-hmm.
Okay, so he's New York State.
Mm-hmm. Elected official, yep. Mm-hmm.
Do you know if he's Assembly?
Mm-hmm.
Or, he's Assembly. Okay, so he's the one who drafted the bill. And Tom's like, well, his district is Eastern Long Island, and they really can't get sewers. So when he drafted the bill, the one half everybody agrees on about equalizing the rates for all the district, making one centralized sewer district. So I think everybody that we spoke to anyway was totally in support of that part. So the part that they had a contention with was that it would be an increase of 1/8% in your sales tax. That's where the money comes from. So this is now what they're talking about is how it's going to be allocated. So the next part was 75% was going to those IA systems, which were these more environmentally friendly replacements for your cesspools, and then so they would be helping you fund that, right?
It'd be grants to homeowners,
They'd be grants, right? Not the full cost.
Right, but it would help to reduce the... It's very expensive to upgrade your septic system, and we have lots and lots of families. I think there's about 380,000 homes on Long Island that are not sewered, and so lots of families that have, septic systems that have been there for a really long time that are not upgraded, and where nitrogen and other nutrients are leaking into our soil and impacting our soil aquifer. So where it's practical, we need to sewer, and this has been studied.
Yeah,
so,
totally. Yeah.
So
the original legislation, which came from the state, the county legislator didn't make this. It came down from the state that Fred Thiel did. So 25% of the money was going to be allocated to sewers and 75% for the IA systems. So that split works well for the East End, but really once you get west of his area, the demand for sewers is much higher, right? So they kind of went back to Fred Thiel and talked to him about it, and he agreed to change it, but they have to wait till January, till it's in session again, so that they could make the split a little bit better for Western communities. That's what we heard. So then it's going to come back, and then it'll be a referendum at some point.
This is an example, though, of where, again, I feel very strongly that...
so could they have passed it now? Sure. And then amended it later?
And they should have. And
You don't know.
That's an option.
And-
That's the other issue. It's
That's
like,
a whole big issue.
are they going to amend it? That's what they did with a little bit with ADUs, because Huntington had the basement ADUs all for 30 years, and then legislation took it over. They were just, and then now you can't get it. Now they're not amending it. Nobody wants it, and you can't get it back.
So there's this concept, great is the enemy of good, right?
Yeah.
And so when we have an opportunity, when we can get infrastructure dollars that are going to run out in the federal infrastructure dollars now, right? Yeah. To put that on hold when we know that this is a crisis situation on Long Island. We, again, fourth most vulnerable to climate change in the United States of America.
Yep.
And, living above our soil aquifer, which is also somewhat unique nationally, we needed to move forward, and I think it was a tragic mistake. And certainly as a legislator, I will put public health as priority number one.
I think, and then just circling back, last night we were talking to Manny about it, and he was discussing the research he did about the IA systems, which is fine, and then he was saying there was some maintenance involved, but he didn't know the details of what, so I asked my husband. And he said that there's a solid side, like in the IA systems, that your waste goes into and it gets kind of separated down into a solid side and a liquid side, and that every few years you have to get the solids pumped out that don't dissolve. That's the maintenance. That's it.
Yeah,
so,
we pump out. We have to.
I just want to. Yeah, that's going to cost. Yeah, that's a service cost.
And then the whole system itself is going to cost around $20,000 to $30,000 per piece, and with the grant.
Yeah, and who did we ask? I don't know if we asked Manny or Tom how much of this money was going to go to help. Meaning if I needed the IA system and then I was able to get this grant, right? How much of it would? It's just what percent? And I think they said it's about like $10,000 off.
$10,000.
Right?
So,
and it costs like $30,000 in the system.
Right.
My friend did it.
And again, this is an area where,
just
like
but we have to do something.
Just like I said with public safety, this is an
Yeah.
area where I'm not going to tell you that I'm an environmental expert. I consider myself a passionate environmentalist, but I'm not an environmental expert. And I look to the folks who have the expertise, have done the research, have studied this, and this is the plan that they put forward, and this is a plan that immediately gets us state and federal matching dollars and allows us to address something that is, I think one of the biggest public health crises of our time. So it's an area I feel very strongly about, and
they said that it'll come back, and they said that the match isn't going to go away, that it'll be there, but we see both sides, because if you do it now, you get the match now.
Right. Don't put it out there if it's not right. If you don't feel it's right, don't sign off on it until you know it's right.
I trust the voters to make a decision. I would trust the voters to say this is not the right decision for my family.
And then as a voter, how do you feel just if there's a referendum, and the referendum will then say, I'm okay an 1/8% increase in my sales tax to be used for this budget, and then this is the percent split. So when I'm voting for it, I'm voting for that percent split right there. And then now, how hard is that going to be to amend next time? Because now you're lying to me as a voter if next year you're changing the split. Not you, but the legislature. You know what I'm saying? If they're detailing, like, these are the parameters, and you have to vote on it, and this is what it's going to be, and then next year that's going to change. Right? I don't know. It's just something. I don't know.
Yeah,
I get it. We get all sides. We get all sides of it. We
and the side that I'm on is the side of the people of the legislative district in 16 and Suffolk County residents, and making sure that they have clean water, and that they're and I think clean water is a public right. I just do.
Yeah, I do too.
And a human right.
Super excited about our sewers coming in Huntington Station.
Yes.
Super excited.
Yes.
Like ridiculous.
Yeah, me too.
$66 million for this little stretch. But they had to do a lot of work on the south, which is the bulk of the cost of it. But anyway, that was interesting, that sewer meeting. Anyway, what's our next question? Our next question is roads and infrastructure. So, do you have any thoughts on that? Pretty much everybody that we spoke to is pretty comfortable with the program that the county's already doing, to the pace that they're repairing and replacing things and stuff like that. I don't know if you...
Yeah, and I think it's just about, again, most of the roads, in the district are town roads.
Yeah.
But I do think having a partnership with the town is important. So what I always don't like is when anybody says, forget elected official, but elected officials especially, well, that's not my job. But we have to have partnerships. We have to work together. And so I would really want to, if I'm elected, I'm going to sit down with Andre right away and understand, what the opportunities are to partner and to do better for Huntington residents. Because I hear every day at the doors people complaining about, that their road hasn't been paved in 30 years or this amount of time. And this is the burden that it puts on their family. And so I want to be able to be helpful and be a good partner with our town highway department. And I think, there's infrastructure opportunities in the county that we need to continue to support. And again, I think this is all about how people feel. And, when your roads or your infrastructure isn't good, you could talk about the economic costs, you could talk about this, you could talk about that, but it's also just how you feel.
Yeah.
And we want our communities to feel well and to have what they need to, to be proud of where we live.
Yeah. And then, at the precinct meetings, everybody asks for those signs. Not the ones that give you tickets, but the signs that show you how fast you're going, the digital ones.
Yeah.
Right? For their various roads that are, whatever. And the SCPD is we don't own those.
Right.
We don't have access to them.
Right.
And whatever. So, that might be something.
But this is where we need to be innovative, right? The county,
exactly.
The county needs to pull, right? We need to work with SCPD as strong partners and say, what are the tools that make it? I want to know, and I don't know.
Yeah.
What are the tools that impact driving behavior? What are the things that change people's driving behavior?
Right.
If you tell me it's one of those digital tools, then it's okay. So how do we look nationally? How do we look at organizations? How can we draw down more dollars to this region?
Yeah.
Right, to put those tools in place, because I can tell you that road safety is by far one of the top issues at the doors.
Yeah.
And I've experienced it because I'm knocking so many doors in so many neighborhoods. Just this morning, I was walking on a court in South Huntington, and some, folks came in a car and they were doing, donuts in the court, and I had to jump out of the way, and it was scary for a minute.
Yeah.
I hear from our neighbors about, Dix Hills Road, right here, and the drag racing that goes on in the middle of the night. I hear Carl Strait Path in the district. I hear all the time about Carl Strait Path and the drag racing that's going on at night. I walk in certain neighborhoods in Huntington Station and South Huntington, I'm hearing more about the ATVs.
Yeah.
But here's what that translates into. Moms and dads being afraid to walk their babies and their children down the block to school. It translates into, I'm not taking the baby carriage out because I don't trust the driver behavior on my street. I'm not walking my dog. I'm not taking that walk, which is important for my physical and mental health. So driving behavior is about safety, but it's also just about general quality of life.
Yeah. Good. Yeah. All right, and the last one is candidate's choice.
We got to the last one.
We're going to get to the last one at some point. We did
So-
pretty good. Look at that.
Yes.
Not even a no.
No,
All right,
I wasn't
so this
complaining.
one is there a question or topic that you wish we'd asked but didn't?
So I kind of covered it already, but I do think, I started to say it at the very beginning, I think that one of the things that we need to be asking our elected officials today, by the way, at every level of government, is about disaster planning and crisis. And so we know
That one agrees with you.
we know that, storms
preparedness
are much
and
more
disaster
frequent.
planning,
Yep.
yeah.
Storms are much, much more frequent, and we need to do a better job of planning for them. Here where we live in this district, there's, huge trees everywhere you go. And we need to be thinking about safety and planning and coordination and communications and continuity. We need to look at, when we think about disasters, all the different kinds of disasters. So we just had a major cyber attack in Suffolk County.
Yeah.
Right? And we need to learn from what we went through, right? And say, okay, how do we look at our vendors? How do we look at the folks that, are providing services on behalf of the county and make sure that they're hardening, their infrastructure so that they can protect themselves if there was to be an attempt. So that there's, penetration testing and those kinds of things that need to happen to keep us, sort of cyber safe. We just went through a pandemic. There could be another pandemic. What did we learn about the inequity of services? What did we learn about where people didn't access resources? Because what we learned in COVID is that we impact each other. So if any corner of our community is unwell, it has the potential to impact all of us. So how can we continue to think about pandemic planning and making sure infrastructure is in place? There could be a chemical bomb. There could be, we look at the international instability, and we have these conversations now every day about terrorism. What are we doing to plan for various kinds of crises? And I think there needs to be a real focus on that. And
the county outside of SCPD,
yes.
does the county legislator have like a
Absolutely.
crisis command center kind of thing?
Well,
like
so
an
no,
emergency response.
So I'm sorry, go ahead.
County does, right?
Yeah, so the county, so FRES runs, Fire
FRES,
Rescue and Emergency Services runs, the emergency operations. You have SCPD, absolutely. But I think that we need to do a job as a county legislature working with our executive, our next county executive, to also just work on disaster planning and strategy and putting together committees that are doing that work. There was great work done on reviewing the Superstorm Sandy response. Let's take a look at that again and see if we're implementing what we learned about that.
Yeah.
Let's look at what we learned from COVID. Let's look at what we, when you're in a crisis, you're, driving the car while you're building it, or what is that expression? Building the ship and sailing it at the same time, right? But after a crisis, we have to do that reflection, and then we have to learn from it, and we have to think about our sustainability. We're an island. So if there was a crisis and we had to evacuate, we have to think about what that looks like.
Yeah.
We have to look at our shorelines. We have to look at, all the different things that impact our future here on Long Island, because this is America's first suburb, and it is a beautiful, beautiful place, and we want generations to come to get to enjoy what we've gotten to enjoy. But to do that, we have to recognize we're also in a time in history when there are a lot of challenges that we face, and we don't have to be caught off guard.
Crazy storms.
We're going to continue to get more of these crazy storms until we really, as a world, take on climate change. But there are things we need to do to take on climate change in Suffolk County, and everybody can do their part to impact a better world.
So if the county could come up with like your plan, right? Not your, but the county comes up with a disaster and response plan. it almost needs to be rolled out also to the towns.
Oh, 100%. It has to be absolutely in concert.
It has to be in
It has to be
with
in
the towns.
concert, yes.
Because right now, like, something will happen, and Diane's, like, literally messaging people. It's like, when's the warming center? Do you have a cooling center?
No, it has everything.
And then they're scrambling.
And it's all about communication.
Yeah.
It's all about
So
communication.
if they had, like, a checklist, like, if this happens, then that. Flip a switch.
It's all about
then,
coordination.
and
So
then
there's a
that.
national model. The nonprofit I run today, we run the VOAD, which is Volunteer Organizations Active in Disaster. It's a coalition. It's a national model. We sit on the state board and we run it regionally, but it's partnership with OEMs. It's partnership with FEMA. It's partnership with all disaster responding nonprofits. We need to do that across the board for sure, that disaster planning with multiple layers of government. And then we also need to do disaster planning for individuals. So there was a period of time in the state, in the last administration, under the Cuomo administration, where they were partnering with towns, going to town halls, for example, and doing disaster preparedness training for citizens, right?
I have a kit in my car.
So do I. I have it in my basement, right? And so, teaching you the things you need to do and think about around a disaster. And so government has a role to play, but a second role is also working with the citizenry to make sure people are connected to their own power, their own power when it comes to safety, their own power when it comes to protecting their family. And I think we can do a lot of that work, and I think we have to do a lot of that work now because we've seen that this isn't going away.
Right.
And it's something to be excited about too. It doesn't just have to feel big and weighty, because it really is about our own human power to endure, and making sure that we're doing the things that we need to do so that when something happens, we're not starting from scratch, but we're already planful and sustainable.
Yeah. Definitely makes
I hope
sense.
that was a good question.
That is definitely a good one. That is a good one. That's a really good one. That's it. Closing. Do you have a closing?
It would be
This is a nice chat.
the honor and privilege of my life to serve as our next legislator in District 16. And I can pledge to all of your viewers and certainly to all of you that, number one, I'll be a great partner to Huntington Matters. But number two, I'll be a great partner to every family and to folks who live in this district and live across Suffolk County. I love people. I love you. I love the families that I get to meet every day and the work I've done across my career, which has been in public service, and being able to be a policymaker and advance our future in a meaningful way so that people can live their best lives. That would be the privilege of a lifetime. And I hope you will vote Tuesday, November 7th.
And if you're getting her postcards, right, your postcards and Manny's postcards, then that's the district that you're going to be voting for.
Yes.
When you go on Tuesday, because the lines have changed. So, like, for instance, my current legislator is Tom Donnelly, who's District 17, but now, January 1st, I'm going to be in the 16th district, so it's either going to be Manny or Rebecca. So, but I'm getting their postcards now, so that's basically what you have to go on, so to know who your choice is going to be. All right. Thank you guys for joining us. We had a great time with our 13 interviews for election 2023. Get out and vote.